How to relieve shoulder pain. The shoulder is perhaps the most flexible and the most overworked ball and socket joint of the entire human body. It is composed of 3 bones, namely the humerus or upper arm bone, the scapula or shoulder blade, and the clavicle or collarbone. The head of the humerus is shaped like a ball, which fits into a shallow round socket in your shoulder blade called glenoid. This relatively small ball and socket joint called the glenohumeral is encapsulated by a covering of muscles called rotator cuff and is secured in its place by strong cords called tendons. Moreover, a layer of cartilage forms a cushion between the bones to keep them from rubbing together and to absorb any shock impact. Within this cocoon of cartilage, muscles, and tendons, a soft tissue called synovium secretes fluid to keep the joints lubricated and the cartilage healthy. Causes of shoulder pain. Since the shoulder is the most flexible joint, a number of factors and conditions can contribute to shoulder pain. The most prevalent cause is an injury to the soft tissues, including the muscles, tendons, and ligaments within the shoulder. This could be due to repetitive use or overuse injury. It can even be due to soreness of the tendon in the rotator cuff. Sometimes, the pain in your shoulder is actually emanating from injury to some other adjoining area, such as the neck or biceps. This is known as referred pain and does not aggravate with shoulder movement. 1. Cold compress. Cold compresses are highly beneficial in alleviating shoulder pain. The cold temperature helps numb the area, which in turn reduces inflammation and pain. Put some ice cubes in a plastic bag and wrap the bag in a thin towel. Place it on the affected area for 10 to 15 minutes. For swelling, reapply the compress after 2 hours. Keep doing this until the swelling and pain subsides. Alternatively, you can also soak a towel in cold water and apply it on the distressed shoulder. 2. Hot compress. Just like cold compresses, hot compresses also help treat shoulder pain, inflammation, and swelling. It is, however, best to use hot compresses at least 48 hours after the injury has occurred. Hot compresses also help relieve the pain stemming from tense muscles. Fill a hot water bag with hot water and apply it on the aching shoulder for 10 to 15 minutes while lying down comfortably. Repeat a few times a day until the pain goes away for good. Also, you can stand in the shower and run warm to slightly hot water on your shoulder for 5 to 10 minutes. Try to keep still while exposing your shoulder to the soothing stream of water. Additionally, you can enjoy a hot shower twice daily. 3. Massage. Massage is another good way to reduce shoulder pain. A gentle massage will help your shoulder muscles release stress and tension. In addition, it will improve blood circulation and reduce swelling and stiffness. You can also get someone else to give your shoulder a nice and gentle therapeutic rub. For the purpose of massaging, olive, coconut, sesame, or mustard oil will work just fine. Before beginning the massage, take a hot bath or shower for 10 minutes to relax the tight muscles. Do massage therapy a few times daily until the pain subsides.